fever, cough, sore throat, fatigue, body aches. When these symptoms strike, what illness do you immediately assume is the culprit? Flu perhaps? Or COVID-19? Maybe it's strep throat or RSV. These illnesses have similar symptoms and they all affect the respiratory system. But there are some key differences you should be aware of because they determine how you might treat it. Flu, COVID-19, and RSV are all spread from person to person through respiratory droplets. So if an infected person coughs, sneezes, talks, or even touches a surface after they've had their hands in their mouth, and then you touch that surface and pass it to your mouth, nose, or eyes, you could get infected. And flu, COVID-19, and RSV are caused by viruses, while strep throat is caused by bacteria. There are other differences too. Consider the flu, which is short for influenza. In addition to those symptoms, the flu can also cause headache. It typically lasts for a few days to a week, and while most people recover well, high-risk populations such as older adults, people with underlying medical conditions, pregnant women, and young children can experience complications. Effective vaccines are available to prevent the flu, and antiviral medications can be used to treat it if you get it. COVID-19 symptoms can range from mild to severe and can include shortness of breath and loss of taste or smell. Some people may have no symptoms at all, while others may develop severe illness, including pneumonia, acute respiratory distress syndrome, and multi-organ failure. In the most severe cases, hospitalization and mechanical ventilation in an intensive care unit may be necessary. COVID-19 can also lead to long-term health problems in some people, especially older adults, people with underlying medical conditions, and pregnant women. Effective vaccines are available to prevent COVID, and treatments such as monoclonal antibodies, antivirals, and steroids can be used for severe cases. RSV, which is short for respiratory syncytial virus, is a common respiratory virus that can cause wheezing in addition to cold-like symptoms. It is highly contagious and can cause severe illness, particularly in high-risk populations such as premature infants, young children with congenital heart disease or chronic lung disease, children with compromised immune systems or neuromuscular disorders, as well as adults with compromised immune systems and older adults with underlying heart or lung disease. Mild cases of RSV will resolve on their own, and over-the-counter medications can be used to manage the symptoms. Hospitalization may be necessary for more severe cases because those patients may need oxygen therapy or mechanical ventilation. As a child, I was hospitalized and put on oxygen because of RSV. Here I am. Now let me talk about streptococcal pharyngitis, what we commonly call strep throat, which is different because it's caused by a bacteria, not a virus. It can cause headache, white patches in the throat, and swollen lymph nodes in the neck. Strep is common among children and adults who are in contact with those children. Most people are treated with antibiotics and recover without complications. Some key takeaways: flu, COVID-19, RSV, and strep throat may have similar cold-like symptoms, but there are some key differences that determine how they're treated. Vaccines are available to prevent RSV, COVID-19, and flu. To avoid spreading or contracting any of these diseases, it's important to practice good hygiene, such as frequent hand washing, covering coughs and sneezes with your sleeve, and staying home when sick. Seek medical attention if you develop symptoms, and follow the advice of healthcare professionals to prevent the spread to others. If you have questions about health conditions, I would love to hear from you. Comment below, hit subscribe, and join me here next time for answers you can trust.